So I'm going to talk about rehabilitation. So rehabilitation is rehabilitation using a Wii. How many of you have played with a Wii or have one? Yeah. So traditional physical therapy is boring because the whole idea of this physical therapy is the repetition of movements. And that just gets boring after a while, especially for kids in rehab. It's also very expensive. The equipment that's needed and the number of people needed makes it very expensive. And also, it's painful because you're moving things that hurt, trying to make it better. So, what if we could make physical therapy more exciting, less expensive, and fun? How could we do this? Well, with the Wii. This is a case study of a 13-year-old with cerebral palsy and mental disabilities due to being born heroin dependent. By using the Wii, his walk with forearm crutches went from 15 feet before using the Wii to 250 feet after. And twice during the study, another 13-year-old was brought to do the Wii activities with the patient. And the patient then told the staff that he was using strategies that he'd learned from the other 13-year-old. And also the patient, he had some attention deficits, but by using the Wii, he maintained his attention for a sustained amount of time. Yeah. This is a graph showing his total time and then divided in standing and time sitting. As you can see, as he goes on, his time increases for each. And then this just shows how the order of the different games and how long he played the different games. And you can also tell which ones are his favorite by that. So, by using the Wii in physical therapy, it improves balance, coordination, social skills, because you can have multiple players with the Wii. You can, especially kids can work on sharing and teamwork and then communication. It also improves cognition. It involves thinking and strategizing, planning, and also works on memory. It improves the range of motion because the patients, they get so distracted by playing the game, they forget that they don't usually move a joint farther than some position. So they get distracted and just move it without thinking. It also extends the duration of this therapy session because the patients get so involved in the game, they keep going for longer. Because there's so many different games with the Wii, patients can practice the same skills, but also maintain attention. Also, the patients can do things they couldn't do in real life. Things like skiing, golf, baseball, and fishing. Things that would be impossible for them, especially if they're like in wheelchairs. And so. And then I have a video clip of patients' reactions to using the Wii.
For those of us in good health, playing the Nintendo Wii or the Wii Fit is all fun and games. But here at St. Mary's Medical Center in San Francisco, one doctor is using it for physical rehabilitation purposes.
You're not using the walker at all? That's excellent.
The spark went off in my mind that I could apply this technology to the world of rehab and really help patients with their physical deficits.
It's more fun because I think you don't feel like it's therapy.
Dr. Justin Liu is a self-described techie and the chair of the hospital's back and trauma rehabilitation department.
It's something that where my personal life carried over into my professional life.
Ever since St. Mary's WeHab program began at the beginning of 2008, more than 100 patients with varying degrees of disabilities have been helped.
The doctor fused some bones in the ankles.
Can you see it a little bit there? Straighten that leg.
I have had MS for quite some time, and this was a stabilization surgery. It really has helped strengthen the left side, and it helps me with my balance.
Because of the challenges that the game is putting forth, and then the overall fun factor, a lot of times the patient completely forgets that, I'm weak on this right side, and so we're really pushing them to use that extremity that's weak without them even knowing it.
The WeHab therapists say patients seem to benefit the most from the Wii Fit's balance games like table tilt, yoga, and ski slalom.
Nice.
Yes, going to the Olympics.
Jamie Weinman is a mother of 3 and a recent brain tumor survivor.
So they took part of it out, but my whole left side was affected.
By playing the Wii Fit, she is forced to learn how to shift her weight on the balance board in order to win the game.
It helped my leg get stronger, it helped me with my balance, and it helped me with coordination. The more you use it, the better you get, and so your balance gets a little bit better, and it kind of gets you excited to do it again, because I'm trying to beat my last score.
Despite these small successes, Dr. Liu suggests a combination of therapies and only using the Wii for rehab with a trained professional.
You'll want to write off the newer technology as a fad or whatnot, but I think this is real.
The only problem is that the Nintendo Wii and the Wii Fit are incredibly hard to find. They've been in super high demand ever since they were released, and for good reason. I'm Kara Suboy, CNET.com.
So you got to see the Wii actually in use in therapy. So currently Wii is being used for rehab in nursing homes, children's hospitals, and rehabilitation centers. In Charlottesville, the Kluge Children's Rehabilitation Center is using the Wii and have had great results from it. Then adult rehabilitation centers and even military rehabilitation centers for veterans who come back and have problems. Already there's been improvement to the Wii, not for rehabilitation purposes, but for commercial purposes. It's the Wii motion attachment, and it's just a little piece that attaches to the end of the Wiimote and makes it more sensitive. So you move a little bit and it's more sensitive to the movement, which can be very helpful when using it with someone who has very little motion. So the Wii is the future of rehabilitation. With the Wii, there haven't been very many studies. I've only found one case report, and that's the one I told you about. So there's more study to be done. And then also they can program games that'll do a specific thing and still be fun and interactive for the patient.